So, hello everybody, and welcome to this session. I think this is the penultimate session for the summer learning programme. My name is Deborah Vogwell, and I'm from Homes England. So, I'm really pleased to welcome you to this session. The summer learning programme offers a series of knowledge sharing sessions on all sorts of topics that you've told us are of interest to you. So today's topic is on improving public health through design. So this summer learning programme is brought to you by Homes England's Local Government Capacity Centre. So the topic for today is a really important focus in Homes England's new strategic plan. So on the slide here, you can see Homes England's new mission, which is described in more detail in our strategic plan. And if we could just go quickly on to the next one as well. And we've got our objectives, our strategic objectives are summarised on this slide. I'm not going to go through this in detail today. But in terms of today's session, I think it's really clear that creating places for people to live that actually, actively, positively improve health and well-being is a really important thing in underpinning all of the objectives, which we can see on the screen here just now. And obviously, creating places that benefit people's health is quite clearly just absolutely the right thing to do. So I don't think anybody could argue with that. So I hope it'll be really useful today to see some of the tools and techniques and ways in which we can all help to contribute towards that. So could I have the next slide, please? The Local Government Capacity Centre provides all sorts of sessions like this one to share knowledge and information, and to help us all find better ways to create regeneration and high quality places to live. And this programme is developed in response to the type of information and support that you have requested. So we really look forward to hearing how you feel we've done at the end of the session, and really look forward to getting your feedback on what you might you think you'll need in a future session. So if we could go on to the next slide, please. So we've got a really simple agenda for today. We've got two presenters, Michael and Natasha. I'll introduce them both properly in a second. We've got a Q&A session at the end, and we've got a couple of polls during the session. So in terms of introducing our presenters, we have Michael Chang and Natasha Reid. So Michael is a Chartered Fellow Town Planner and Honorary Member of the UK Faculty of Public Health. He is currently Programme Manager at the Office for Health Improvement and Disparities, and he's responsible for planning and health, and he provides policy and practical advice on all sorts of things related to planning and public health. At the moment, he's leading an advice note on health in design, which is due for publication shortly. He's also a member of various design review panels, including one in Essex and also the Design South East one. So Natasha is the founder of a design research consultancy, which is called Matter Space Soul. Her consultancy specialises in shaping places for health, well-being and social sustainability. So she's currently working as part of the public practice programme, where she's working with Brent Council and leading on an innovative supplementary planning document, so an innovative SPD, which incorporates a new place quality framework. So this aims to embed health and human-centred design considerations in the way that development is designed and assessed for planning permission. So she's also a design review panel member for London Borough of Redbridge as a healthy places and inclusive design expert. So we've got two amazing speakers today with a huge amount of knowledge. In the Q&A session, we'll also be joined by Amy Burbidge, who is our head of design within Homes England. So I'm going to hand you over now to Michael. So Michael, are you ready to take over? Brilliant. There's Michael on the screen. So I shall hand over to you, Michael. Thank you very much.
Thank you. Thank you. So delivering health net gain through the design process is the main topic of today's session. So Natasha and I will present to you a narrative about thinking about designing your places and spaces differently with the intent to improve population health and well-being, and obviously address health inequalities as well. Not necessarily doing things new, but hopefully differently with the involvement of public health professionals. So I do look forward to your feedback and kind of discussions throughout today's session. So good morning, everyone. So I'm Michael Chang, as Deborah has already introduced. So I'm the Office for Health Improvement and Disparities Program Manager for Planning and Health, and I work within the Housing Planning and Environments for Health team. Very briefly about the program and OHID. Next slide, please. Very briefly, so OHID exists. We operate within the Department for Health and Social Care, and we have obviously a various number of programs around healthy places, but also more widely around obesity, physical activity, mental health, etc. My program area around planning for health as it relates to the design agenda, as you can see on the screen, I do a range of different issues and work around design and design quality for housing and other developments, primarily around research, building the evidence and data, writing guidance, as Deborah said, they will be publishing hopefully shortly in advice notes, which I'll go through later on. Influencing policy with DLUC and other government departments and agencies, for example, working with Sport England on their design guidance. And then finally, doing capacity building, engaging with the local systems, local authorities to help them upskill the professionals around the whole public health and planning agenda. So that's what I do around health and design for now. Next slide, please. Thank you. So in my presentation, I would like to kind of take you through a narrative to kind of link the evidence to actions that you may be taking in your various work around housing, urban design, planning, whatever it may be. So we always know, and we've always known, there's a strengthening narrative around planning, design, and health. And I won't go through the design and evidence base in great detail in my presentation. I think we all recognize and can refer to different publications and evidence base from government departments, researchers, first sector organizations, even government agencies as well. So I won't go through those. But I do want to highlight two particularly important recent publications, if you like. So firstly, is the Farrow Review by Sir Terry Farrow, commissioned by the Department for Culture, Media and Sport a few years ago, looking at the design quality agenda. And they did say that in this particular case, the contribution of the built environment designers to improving our quality of housing and health and well-being are fundamental to solving the housing crisis. So therefore, requiring health in design isn't necessarily a burden, but actually help, increase quantity and quality as well. And then more recently by Oxford University, the Kellogg College, the Creating Healthy Cities Commission, they noted the responsibility of local planning authorities in determining all aspects of development. It is to them and obviously others as well that we look for an increased emphasis on prioritizing health and well-being in all new developments. So we know the evidence base is very clear. We know what we have to do, and we know that there's things that we can and will do that can impact on public health. Next slide, please. The really important thing that I would like to emphasize today is, like I said earlier in my introduction, we're not necessarily asking you to be doing things, new things, but actually doing things in a different way. And by doing things in a different way, that requires you to think about the impact and the outcomes of your decisions and your actions, both in policy, when you design practices as well. And so this diagram, which I want to go through, the gray one at the top, is from a Public Health England evidence review around all things around environment and health. And they came up with 5 themes that will influence people's health in the built and natural environment. In particular, I'm highlighting the neighborhood design characteristics. For example, looking at enhancing walkability in the neighborhood or building compact and complete neighborhoods. We really need to think beyond it and say, well, actually the impact, both positive and negative on health and well-being is X, and ultimately on the outcomes for population health and well-being, both physical and mental, is Y. So we have to think about that narrative as we design and plan our places and spaces. And we can quantify some of these actions and some of these impacts and some of these outcomes. An example will be providing access to green spaces. So for example, if you increase one particular research, 0.1 increments of green space or vegetation, you can reduce within 500 meters of your home, for example, you can reduce, by 4% risk of lower risk of mortality. So we can quantify those things in both monetary terms and kind of evidential terms as well. So being very clear about your narrative. Next slide, please. Thank you. So one really key important focus looking at health inequalities, and Public Health England previously and now OHID, we do have a definition or interpretation of health inequalities according to four domains. One is looking at the protected characteristics. Obviously, this one Equality Act looking at people from different backgrounds. So, for example, for design, people in the elderly population or different gender groups will experience the built environment in a different way and therefore will have quite specific and different design needs. Secondly, looking at the socioeconomic deprived population group, for example, people under deprivation measures like education, natural environments or employment, will have access to the environment in a different way, and therefore their needs are different as well. Thirdly, inclusion health and other vulnerable groups. For example, people in other different groups, travelers, the homeless groups will experience and have different needs from the built environment, and therefore how do we design for their needs? And then finally, geographical and area variation. So for example, people living in rural areas or in countryside, coastal areas will have different needs around the built and natural environment. Now, in design, it may not be necessarily designing specifically for a group, because then you can exacerbate disparities. But how do you address the differences in how people experience the environments? And that's the kind of key question that we want to address throughout our presentation. Next slide, please. Thank you. So the question is, how do we go about doing something? Do we reinvent the wheel, or we just better use the wheels that we've got currently? So, for example, the NHS England Healthy New Towns program back in 2016-19 did try and test new ways and improving existing ways of doing, both design and planning, but also community activation and also providing new models of health and social care. And so they tested these through 10 demonstrator sites. Many of you may be from one of these demonstrator sites, from Cambridge to Oxford to the north, or even to the west of England. And actually, they found that you can do them within existing powers and levers that you have in local governments. And I would just say I would encourage you to have a look at these 4 publications that was released back in 2019, produced between NHS England, Public Health England, Town and Country Planning Association, and the King's Fund. So please have a look at those in your own leisure. Next one, please. Thank you. So one quick example is looking at Barton Park, and there's many of you may be familiar with Barton Park in North Oxford, a joint venture between Oxford City Council and developer Grosvenor. Addressing health inequalities was a central aim of the project, of the demonstrator project, and because they are in close proximity to a quite a deprived neighbourhood in Barton Park, and the whole development was aimed to establish a good link between the new residents and the existing community, and they've done so in quite a good way. And I'll encourage you to look at our publication to see what they've done in Barton Park. I won't go through that in great detail, just to say that there are good things happening across the country. So we have to recognize them as they happen, rather than say nothing good is happening around health and design. So the next slide, looking at the policy context, and many councils will be required to look at design policies in their local plans. For example, the National Planning Policy Framework is quite clear that policies and decisions should be looking to create places that are safe, inclusive and accessible, which promotes health and well-being. And actually most councils do have a design policy, but not all councils have a design policy that relates to references or addresses the health and well-being needs of the population. And you can clearly see from the figures there from the Town and Country Planning Association local plans review from 2019 that there's some disparities across the country in terms of design policies for health. I think the question is, if you're not designing for the health needs of your population by direct reference to the public health needs and priorities of the local authority, then whose health are you planning and designing for? That's a question I pose to the participants in today's session. Next slide, please. Thank you. I think really important to set the context of OHID's position on design and health in context of government and DLUHC's guidance, because obviously we work within DLUHC's framework rather than going over and making up our own kind of guidance. So many of you will know the National Design Guide and the National Model Design Code, which frame the work that you do around both design coding, but also design in general sense. And there's a direct hook in the National Design Guide and the National Model Design Code about using design codes and design guidance to create healthy places. So there is that hook there. We're not making things up around health and design. It is there in government policy and guidance. Next slide, please. Thank you. Design codes and design guidance that you may produce coexist with other range of design guidance from both nationally and internationally. And I'm presenting to you just 3 examples here as well, that actually the range of health-led design guidance can be from both the private sector. Many consultancies would like to add their own value, and therefore they create their own healthy planning or healthy homes checklists. That can come from the public sector, so I said DLUHC, but also other government agencies, Sport England, Natural England, and OHID as well, and how do they align? And obviously now Active Travel England. They can also come from third sectors, the NGOs who may be promoting a certain way of designing things. So adopting any of these guidance in the work that you do in both local planning, your urban design practices, I think be really useful to ask yourself this question or these questions. Is there a clear explanation of underpinning health evidence? So is the document informed by evidence, not just passive referencing, but each individual points are referenced, so clearly there's a difference that you can make with the actions that you'll be adopting. Secondly, is the guidance clearly framed around a clear definition of health? So rather than just saying we want to promote healthy environments, what do you mean by that? Is it for a particular population, or is it for a particular kind of health outcome? Being very clear about it. And then finally, is the guidance clear about how health outcomes can be achieved or evaluated? So are there indicators and things to say, well, how do we implement and constantly monitor and evaluate the actions that we'll be taking and the outcomes that may arise from that for population health? So being very clear and being critical about the frameworks that you adopt, because in my view, some frameworks out there, they may not be around health, but is framed and titled around health. So just being very clear about it. I'm highlighting you today the Building for Healthy Life, which Homes England promotes. And obviously Sport England and OHID and Active Travel England jointly published a document a couple of months ago looking at active design, which is an update from the 2015 documents. So I'll encourage you to look at those 2 documents in your own time. Thank you. Next slide. Thank you. So I'm going to put more detail now around the design coding and design guidance around health in my kind of next set of slides before I end and passing over to Natasha. So what is a design code in the context of promoting healthy and safe communities? So we all know what design code is and isn't. So it provides quite specific parameters, in some ways metrical or even visual, for the physical development of a site, neighborhood, or area. For health, it definitely should set out the building blocks of how these different spaces and places can work together and can be used to deliver a range of different priorities and and policies, ultimately with the primary objective to achieve health and well-being needs as identified by your local authority and published by the public health teams. And so throughout the design process, promoters of the design process should really consider how to accommodate the different needs of the communities, so addressing health inequalities and develop an understanding of the impact on these groups. So like I said earlier, it's not just about designing for that particular group, like women-friendly environments, child-friendly environments, age-friendly environments, dementia-friendly environments, but actually how do you accommodate for the differences in the experiences through the design process, which can be quite complex. I appreciate it, but just be mindful that we're not exacerbating health inequalities. So that's why I think design code should be about in the context of promoting healthy and safe communities. Next slide, please. Thank you. So OHID's kind of proposed approach is very much looking at design coding that all councils are required to do at the local authority level, aligning that with the DLUHC's 10 themes, looking at the different spatial scales, neighborhood, local authority, neighborhood to site, and then obviously framing all of that around the 4 domains of health inequalities. And around all of that, you need to have monitoring evaluation to know how you're doing things and whether you're making the impact on that. So that's the kind of framework that we're working within with the OHID document. Next slide, please. Thank you. So in the next few slides, you can see I'll go through the design coding process, again, very much framed within the DLUX guidance, the code considerations, just giving you some examples of what we mean by designing for health, and then some implementation advice, what you could do to help implement health in the design planning process, and then just give you signposting to annex on evidence as well. So in terms of this particular design coding process from the MNDC, so again, we're not adding new stages to what you'll be expected to do in your design coding, but we're following the DLUG guidance around 1, analysis, 2, vision, and then 3, coding. So firstly, on the analysis around scoping and the baselining, so how do you bring in the relevant health stakeholders? And so if you can look at local authority, this will be your local authority public health teams who are now very much embedded within local government system. How do you supply and apply the relevant health evidence in the design studies, in the scoping work? So how do you use the joint strategic needs assessments or any other public health evidence in the way that you approach design for the particular area? And then how do you align all of these things with other environmental determinants of health and spatial priorities? So that's kind of first thing to say. Second thing on visioning. So how do you reflect the local healthy places values? And actually many councils, public health strategies will have elements of healthy places and planning and environments in their strategies. So how do you reflect those public health priorities into the kind of healthy places vision in your local design code? And how do you co-create that vision that can deliver health benefits? And then thirdly, how do you set out in your visioning and your kind of master planning coding the indicators for monitoring evaluation for the implementation of the design code, but also obviously ongoing design and planning practices as well? And thirdly, for the actual design code, is it informed and driven by current evidence of what works? I know sometimes it's quite challenging to find a direct correlation between a particular, planning and design practice with, health outcomes. But there's things that you can do to triangulate, that particular narrative that I mentioned earlier. How do you complement existing public health initiatives? So sometimes it's not about just the physical environment, like with the Healthy New Towns. How do you align, say, for example, the building of a cycle lane to, local active travel, educational programs from the local authorities? How do you align and complement each other? Because the whole systems approach is what you need to make a difference rather than incremental and ad hoc approach. And then finally, thinking early about joining up implementation tools. So many of the current implementation tools that you have at your disposal, design reviews, assessments, whatever it may be, how do you make use of those and join up? And so when you have a design an access statement or travel planning, you can use it for health as well, rather than trying to advocate for particularly new and separate new health tools. So again, the design coding, advice that we provide is very much set within your current processes, and hopefully it wouldn't add additional, burden and things that you have to do. So we all know you're very stretched in local authorities. Next slide, please. Thank you. So just in terms of the co-consideration, so we do adopt the National Design Guide's themes, the 10 themes in our work. So we've kind of readapted, if you like, that diagram to how do you provide a healthy place within, the current guidance. Our advice note will set out some strategic principles around health and design. It will set out some design code outcomes they may want to adopt for health in our document. It sets out some baseline considerations that key government departments have already produced for you. So, for example, manual for streets, active design, the GI framework and design guide. So our document actually for those particular policy areas don't actually regurgitate or repeat current guidance from other departments and agencies. We just say, here's a baseline. In addition, we may want you to think about things that are maybe more for health and public health issues. And then, we have an action checklist for those preparing a design code focused on health. and then signposting to current evidence as far as we know on some key things as well. So the next few slides, I'll give you some examples. Next slide, please. So I'm particularly an example around movement and access, which is one of the 10 themes from the NBG. So a key outcome that we would like to promote around design coding for health is having a well-connected, and you may recognize the wording already. And actually, like I said earlier, it's really not about doing something new. It's about framing things in a different way and thinking things about differently to meet population health. So design code outcome will be looking at a well-connected network of routes that allow shifts in people's travel behaviors. So about behavioral change, and they embrace active travel measures and supports independent, safe movements by different groups of people, older people, women and girls, children and young people, without, fear, with a perception of fear when they're moving about in their neighborhoods. This means promoting physical and mental health through increased physical activity, uptake of different modes of travel, better air quality, more tolerable traffic noise levels, and fewer road accidents. So some of these outcomes, we will obviously, we all agree with, and we wouldn't really, disagree with, if you like. So an example will be looking at one, improving access to everyday destinations. So how do you improve access through active travel means to things that you access in your daily life, whether it be the shops or your work place or your local park, for example. So, for example, improving access to everyday destinations, it should, your action should be taking will be around access to recreational facilities, your schools and your workplaces. That should lead to increased walking and physical activity rates with the population groups that you want to influence. And ultimately, the health outcome is improved cardiovascular, outcomes for people's health. So that narrative has to come through quite clearly in the work and interventions that you adopt. Next slide, please. Thank you. The next one is on built form. A design code outcome for health will be a well-designed and appropriate densities and configurations of spaces that enable positive and comfortable experiences for the population groups. This can enable better social connections and avoid the unintended consequences of, say, overshadowing and loss of natural daylight, when you, shaping your and placing your forms in your design coding. So one example will be, promoting compact and density of developments, which is one of the key kind of interventions in the Public Health England evidence review. By that you improve the quality of living for, say, potentially urban populations, people living in high-rise apartments, appropriate density and suitable living spaces that you will provide for those people. And ultimately, from evidence, we know that by doing that, you can reduce depression and also mental illnesses as well. So again, that narrative has come through very clearly in the work that you do. Next slide, please. Thank you. So finally, another example is looking at public spaces. A design code outcome for health will be having an inclusive, mixed-use, vibrant, and welcoming environments for everyone. Excuse me, to invigorate a local sense of place. This is critical to building strong, healthy communities and enhancing individual mental health and well-being. So an example will be defensible spaces. How do you, provide spaces that can be used by, say, women and girls at all times of the day, so daytime and nighttime, the appropriate lighting strategy and the types of lighting that you may want to promote. We know from evidence certain types of lighting is an influencing factor in, in kind of both safety and security issues. So being very mindful of the type of lighting that you use. And then finally, the outcome will be improved safety and the perception of safety, and that will lead to obviously a better health outcomes for mental well-being as well. So we kind of take you through a range of different narratives in our documents, and obviously advice in generally. I think the main point is looking at. Thank you. I think we will share the slides with you so you can see them. I'm just reading them out, so they're not completely essential for you to see them for now, but you can see them afterwards. So we do take you through some of these principles and ultimately the kind of evidence for you to think about in your work. The next slide, we're looking at implementation. So we do promote a systems approach to designing healthy places. We know from the work for the UK Collaborative Centre for Housing evidence that having a systems approach across the whole of the planning process is quite important than just looking at one or two things during the process. So for public health teams and planners and urban designers and developers, aligning wider efforts to integrate health into local planning policy and practices that should always underpin things around design coding rather than just looking at design coding on its own. And obviously the paragraph 133 of the National Planning Policy Framework does encourage the use of other tools to help improve the design of developments. And we do say for some design reviews is useful if you have the right expertise around public health, around the panel. Health impact assessments, that's useful. I know in places like Essex, they do link design quality assessment with the use of health impact assessments in their Live Well accreditation scheme. And then finally, place audits, you may be aware of those as well. And then finally, there's a need for monitoring evaluation. How do you build that into that as well? We give you some advice around how do you create an evaluation framework to be sure that you will achieve the health outcomes that you've set out to achieve. So the next slide, please. So just in terms of, because illustrating one example. So this is particularly at a local authority scale, and this looking at just illustrating in a snapshot what many of the considerations that we have in a document mean at the local authority scale. It's not in a utopian diagram. It's meant to illustrate things in context. So hopefully those will be useful to that. Next slide, please. Thank you. So just to kind of finish off my presentation, two things to highlight to the audience today. So one is, like I said earlier, my first slide around my planning and health program around design. We will be running a series of regional workshops and site visits with Sport England, and we'll just be embarking on planning for these from next week. So our primary audience will be public health teams, and obviously others, if they want to come along, they can, but capacity will be an issue. But be running one in each region. So please look out for those. The idea for the capacity building regional workshop is to try and make some of these things that we'll be publishing, bring them to life. We'll walk around a site and see how we can have a good design review panel discussion around health on these sites and critique them in terms of health and well-being. So the next final slide is looking at just some final points, calls to action, and just summarize my presentation. So I think I've already made the point multiple times. There's no need to do things more. I think we know that we have to do things better. From the CABE days to the the housing orders, from then to the place of alliance housing. We know that we have to do things differently to improve the outcomes. But doing things differently and intentionally to consider the why are you doing it, and who are you designing for health? That's the key question that you should all ask yourself. And then obviously linking that to the public health needs and priorities and evidence base published by your local authority public health teams. There is no such shortage of design for health tools. As I mentioned, there's actually a proliferation of different design for health tools and frameworks. Be clear about the ones that you use that's informed by evidence and clear research, rather than just something that's something someone's made up. So be very clear and be critical about the ones that you adopt. Thirdly, deconstruct slogans and buzzwords. I probably use many of them today, but things like beauty and others, they need to be, if you like, understandable and implementable from a public health perspective. What are their constituent parts and how do they impact on population health and well-being? So being mindful of the language that you use. And I know I probably use one or two terms that I shouldn't be using in my presentation. So thank you for picking that up in the chat. And then fourthly, involvement of qualified public health professionals should be a prerequisite. And the guide, obviously, it's very much aimed at public health professionals to be involved in design coding. You should be involving them in both design review panels and other stages of the planning process as well. And obviously, how validate designers' claims about healthy places, because otherwise, how will you check whether designers, when they promote a healthy master planning, that it is healthy if you don't involve public health professionals? And then finally, don't be afraid to experiment, but experiment together with your stakeholder groups, and then obviously evaluate to make sure they make a difference. So hopefully that's a kind of a useful run through of the work that we do in Elkwood around design for health. Please do, next slide, please. Please do look out for our advice notes, which we hopefully will be publishing shortly. If you want to know anything about our work around planning for health or other program areas around housing, natural environment, active travel, or air quality, please email us and then join our Knowledge Hub if you want to get involved in kind of peer-to-peer support and discussions. Thank you very much. Next slide, please. Thank you. So we do have a very quick poll for you. So please do take the time to complete the poll. How much do you think current planning and design guidance supports healthy urban design practices from 1 to 5? Be really interesting to see your responses to that. Thank you. So very useful chat as well. And with that, I pass over to Natasha, who will give you a good example from a local authority in North London. Thank you.
Thank you, Michael, and good morning, everyone. It's really interesting to see the poll results, as I'm going to follow on from this theme by sharing some new design and planning which I've developed called the Place Quality Framework. And I'll show how that's being applied in the Barton. I'm Natasha Reid. I'm founder of Matterspace Soul, a design research practice on wellbeing. And just as some context to this work and where it's coming from, my background is in architecture and urban design. But 10 years ago now, I diverted away from traditional practice to explore more deeply the human and social dimensions of places. For me, this is what matters. And so this has involved working across many different disciplines to explore new ways of shaping places according to how they affect people, their well-being. And over the last year, through the public practice programme, I've been working partly within Brent Council in-house on a new SP, this new place quality approach. So is the audio not coming through? I might turn off the camera just to see if that's any better. Can we hear any better now? Sorry, it's turning off the video.
Yes, that's better, Natasha.
Okay, great. So I'm not sure how much was caught of that, but just to recap, I'm founder of Matterspace Soul, which is a design research practice focused on wellbeing. As some context to this work, my background is in architecture and urban design, but 10 years ago now, I diverted away from traditional practice to explore more deeply the human and social dimensions of places. For me, this is what matters, and this has involved working across different disciplines to explore new ways of shaping places according to how they affect people and their lives. Over the last year, through the public practice programme, I've been working partly in Brent Council on a new SPD, a supplementary planning document, which contains this place quality approach. Next slide, please. So this is a different approach to embed health, social well-being and inclusivity into places. And it does this by putting how places impact people front and centre of the design and assessment process in planning, making this a really explicit priority, and then also providing the tools to break this down and achieve this through human-centred design. So why do we need a different approach? Well, as we're all becoming more and more familiar with, the design of the built and natural environment is absolutely critical for our physical, mental and social well-being. And as Michael has set out, there's plenty of evidence of the significant effects of our surroundings on people's lives. But the practice of designing directly for this and assessing this is still not commonplace, and it's not the business as usual focus of development. So the question of how places are impacting people is still often never really addressed in depth, at least. So to address this framework builds on what's current best practice, but aims to go further by bringing in, firstly, emerging leading practice that's across a wide range of factors, including things like biophilic design, which is about the importance of contact with nature, to tackling loneliness and isolation, responding to neurodiversity, to the needs of older people and children, and creating safer places for women and girls. And some of these topics have been covered already in earlier Homes England learning sessions. So it's about bringing these things together now in a holistic and joined up way. Secondly, it's also about evidence-informed design. So drawing upon the knowledge and the research that exists in different disciplines and in public health about how places affect people and our workings as humans. And all this research and evidence just isn't making it into practice right now. So there needs to be ways to make what can be quite complex into something easy to apply in everyday process, whether that's design or in planning. So I'll show how this approach has been applied for Brent. Next slide, please. So what the guidance does, firstly, is to reframe design quality to be about delivering quality of life outcomes. So going beyond numbers, physical form, and visual appearance and how things look. This framework is part of a new SPD for Brent. It's the Residential Amenity Space and Place Quality SPD, which is adopted last month, which means it's now a material planning consideration. And it will apply to master plans, to external and internal places, and to public spaces. So a real range, essentially, of shared spaces, even down to corridors in residential developments. The objective, of course, is healthier, happier, vibrant and inclusive places, but not as a nice to have, but becoming the fundamental expectation for development. Next slide, please. So what's really been really key is to shape this to the particular context in Brent, to the priorities, challenges and opportunities found there. Like many places, it's experiencing significant growth. So generally development has to be at higher density to deliver on housing. The borough has areas of deprivation alongside affluence, like much of London. And the good growth vision includes reducing health inequalities. It's one of the most diverse boroughs in the country, so supporting social cohesion and integration is really key. And tying in with environmental sustainability, of course, as Michael's talking about, systemic kind of approaches is a critical challenge throughout. Next slide, please. And the aim is to deliver on sustainable growth that's focused on what matters to people and communities. And the guidance is helping to do this by prioritising people-focused outcomes, like supporting people's physical and mental well-being, building strong and integrated communities across both new and existing places, encouraging vibrancy and intergenerational mixing, supporting a sense of place and belonging, and fostering a sense of ownership. Next slide, please. And the guidance is structured to address health inequalities and areas of deprivation specifically by expecting development now to respond to the socioeconomic context and the needs of different groups. So on the left is a map of open space deficiency, and on the right is a map of deprivation. So where there is greater need within the borough, there'll be higher levels of expectations to deliver on quality of life, and in a way that's proportionate to the level of disadvantage. Next slide, please. Working closely with the council teams and with members, together we defined what are some of the key place quality priorities, which are factors that would have greater weight in assessment because they're addressing specific local needs. So these have been defined as community gardening. There's many positive physical, mental health impacts of bringing people together in nature. Green infrastructure with its key role in both people's quality of life and sustainability. Young people, there's a very high proportion of young people in the borough. So we need to find ways to support them to feeling a sense of ownership, a sense of safety, and also possibility for the future. Social interaction is really key between different groups in terms of integration and cohesion, but also in the context of high rise and high density, where it can often be more difficult to achieve this naturally than, say, street-based homes. And the overall inclusivity is really key for this particular borough, considering new and existing communities, disadvantaged groups, and more vulnerable residents. Next slide, please. So I'm now going to run through how this framework works in practice. As Mike said, it's not about doing more, it's just about doing things a little differently. So this is based on the human experience of the built and natural environment. So rather than looking only at the physical attributes, it's looking at 3 dimensions: health and well-being, community and belonging, and vibrant and inclusive places. And across those 3, there are 9 criteria for quality of life. So these form building blocks for people-focused places, and they're interconnected, so to cover a range of factors in a holistic way. And this shifts expectations for development by creating a set of new benchmarks for success and for what good looks like, which focuses on that qualitative aspect of places. So what are the impacts for people? How will they experience that place? How will it affect their health and their well-being and their lives? And critically, there is a new requirement as part of this guidance for the benefit to people to be demonstrated as part of the planning process. And I'll show you what that looks like as we go further on. But the aim of this really is to reduce the burden on council teams, and is asking applicants to show why and how their scheme will be high quality and beneficial. Next slide, please. Across those 3 dimensions, there's a range of specific design considerations with examples of what good looks like. Again, I'll go into more detail about that, but broadly speaking, with health and well-being, that's looking more at the direct impacts on physical and mental health. So, for example, spaces that are restorative by reducing stress, improving mood, often green spaces. Community and belonging, that's looking at how we enable social interaction, but not just casual encounters between people. How do we start to build sustained ties, building community networks that support resilience? Vibrant and inclusive places, this is about supporting all different types of people to play an active part in their communities and reducing barriers and inequalities. All of this is underpinned by the importance of nature and green infrastructure, with the benefits for both people and planet, and this will get extra weight and value in the assessment process, particularly in areas of open space efficiency, deprivation, and health inequalities. Next slide, please. So this guidance sets out an approach, but also a step-by-step method with tools to help achieve the new requirements. I want to emphasize it's not a checklist or a sort of tick box exercise that you do certain things and that's it. It's still, the design of places still has to be considered, of course, and this is about opening up possibilities and providing prompts for areas to look at to support health in design. Essentially, it's tools to help people think about what are the conditions and the outcomes and the benefits for people you want to include and create, not just a list of physical features. So what's now required for developments in planning permission will be to submit a quality statement with supporting evidence, and these tools will help define what goes into that statement, which I'll run through. And this has been developed in close consultation with development management teams at Brent. We had a working group to make sure that this really assists with assessment and it's not an additional burden. So next slide, please. So I'm going to run through the tools, and this is quite heavily abridged, but more to give a sense of what it includes. And I'll put a link to information and to the SPD in the chat at the end, so you can have a look at all the details. But I'll run through roughly what each tool is looking at and the sort of thing that it includes. So the first one is looking at the very first principles of design looking at the site, whether that's master planning or a smaller site, but asking applicants to define that they understand the context and the users. So there is a series of questions, starting with how the design is addressing specific user needs. The questions include things like, what is the socio-economic or cultural context of the site? Who are the users and what are their needs? It goes on to look at how people experience that scheme and design. So asking applicants to explain the user journey through that scheme, looking at factors such as human scale and sense of spaciousness, nature, of course, and social integration and connectivity to the wider areas. Next slide, please. And with this first set of questions, there'll be an expectation to provide supporting evidence in terms of drawings where the benefits that have been answered are set out and shown and how it's achieved. And this is in line with the sorts of drawings you'd expect to have as part of regular design and access statements that are submitted for planning. But just the expectation is to really show how those health and social wellbeing considerations are built in from the start. Next slide, please. Then the next level of information to be provided will be going deeper into these different quality of life criteria. They're across the 3 dimensions. We've got 3 sets of criteria, and they start with more baseline practice, which is what you'd expect to see in terms of good design, going to sort of better practice, and then some factors which could be considered leading practice and are not that common, but they're there to be able to raise the level and standards and expectations as well. So just to touch on what they are, they cover in the health and wellbeing, it's about comfortable, active and or relaxing places, creating attractive, restorative and natural places, or creating usable, cared for, empowering places as the kind of leading practice. And I'll go through how that breaks down further. Community and belonging starts with distinctive places, this sort of baseline. Sociable places is the next level, and then places that build community as the leading level. And then for vibrant and inclusive places, we start with safe, legible, welcoming as the baseline, creating integrated and equitable as the next best practice, and then places for different user needs as the leading, and I'll go into what that means. So next slide for that. Through the different tools, the expectation will be to define indicators based on those criteria that are included in the schemes. So these are some examples of what that could be. So for example, for a comfortable and relaxing place, this is an example of a quiet and peaceful courtyard for residents. In the middle, we've got a space that's about building community, where social interaction is prioritised, with common space provided for gathering and mixing generations. And then at the end, we have a space that's about integrated spaces. Particularly, this is good for bringing young people together in an estate in the South Kilburn estate in Brent. Next slide, please. So this is an excerpt of the tools, but just to give a sense of how this works, there is a series of questions here for this health and wellbeing dimension, starting with will the space feel appropriately peaceful or lively, given the type of space it is? How are the benefits of green spaces being maximised? Is it a usable, cared for and empowering place? How is the space actually accessed by residents? How convenient is it in everyday lives? And then leading practice would be about, are residents and communities involved in co-design, co-production or engagement beyond typical consultation? There's lots more questions to this, but these are just a few. And next slide. And with this, there are examples of what that could translate to as a set of place quality indicators. So there are some examples from internal space in terms of making comfortable spaces or sociable spaces as an example of a double height lobby, giving a sense of spaciousness, but also having windows so that residents can see who else is in the building and interact and get to know one another. Below is an example of attractive, restorative, natural space as that criteria. And here we see lots of visual amenity, interest and appeal, which is provided with sensory, attractive and playable landscaping. Next slide, please. So similarly with the community and belonging dimension, set of questions starting from, is this a distinctive place? Does it support pride of place and a common sense of identity? Is it a sociable place? Does it encourage people to spend time there? Are there features that encourage dwelling, such as reasons to stay and pause? So that might be as simple as having seating and benches in a particular arrangement, to something more elaborate. Asking, is this a place that builds community? Are there factors that support long-term relationships between residents? And then leading practice, thinking about, does the design go beyond sociability to create social value and social capital, about those longer-term networks and relationships? Next slide, please. So again, a couple of examples of where that's parts of this being done well. So we've got top left, Marmalade Lane in Cambridge, with places to sit and talk to neighbours. On the right, we have, in terms of social spaces, how to make a corridor somewhere that someone might spend more time in and actually pause. So features to look at, such as art or having a window in there. The space below we've looked at in terms of building community and social interaction. Next slide, please. And then just to round off the tools, the last one, this shows sort of the more in-depth questions. I won't go through it all, but just to give an idea. So it's going from the starting point of, is this a safe place, to going to things like, is there opportunity for people from different walks of life to meet? Is this intergenerational? Does it cater for people of different ages or backgrounds to come together? And how does that happen without there being tension between different activities or groups as well? Next slide, please. And then going into addressing different types of user needs, as Michael was saying at the beginning, how do we consider the needs of specific groups? Who are those groups? So whether that's describing how the needs of children are being integrated, young people, women, older people, people with protected characteristics, disability, or race, all of those things. How does this, go beyond saying creating places for everyone to actually giving specific consideration to those identified user needs, and also thinking about neurodiversity. There's new standards that are coming out, that have come out fairly recently about that. So next slide. And what's important in terms of what's being submitted is that gets these different indicators that applicants would share, would have to be listed on drawings to actually show how that's being done. So that way it's supporting evidence to the statements that get provided. Next slide. And then the way that the developments are assessed are going to be proportionate in terms of the size, so where there's greatest impact on quality of life, and also the type. So there'll be higher expectation for high rise, high density and build to rent, also co-living, and then strategic development has the greatest impact on both residents and the surrounding communities as well. So yeah, this is a way to make it specific to the context and the impacts. Next slide, please. So just to conclude now, the aim with this is to have this outcomes both for people but also for practice. So for people, clearly this is specifically focused to the needs and well-being of people and communities and ways to keep doing that further in the context of particular places. Starting to look at how the benefits of growth are balanced more equitably. This tool can be used as part of community participation and co-design processes. There's a common language that's not necessarily just about design, and this can also be a way to structure design review around health and well-being. Next slide. And then for practice, it starts to make it very explicit what outcomes to design in or look for in schemes and applications. It enables everyday implementation of this into existing design and planning processes. And the idea is really to equip designers and decision makers with some tools for clearer consideration of all the complex impacts of the built environment. And also really helping support all the really good architects and designers who are already doing some of those things by having a really strong vision and backing from the planning authority. So as Michael said, just for me to round up, it's not about doing additional things, but doing things in a slightly different way, starting from the impact on people and putting how places affect us as humans and communities at the heart of the way they're made. So please get in touch if this is of interest. My email address is at the bottom, and I'll put some links in the chat to further information as well. So thank you for listening, and sorry about the audio.
Hello, everybody. Thanks very much, Natasha. That's brilliant. So I think we move on to our Q&A session now. So if I could ask the presenters to put their cameras on, and then we're also joined by Amy Burbidge. Hello, hi Amy. So Amy is our Head of Master Development and Design. Have I got that right, Amy? Shout if not. Yes, I did. That's good. So we've had a whole range of questions in the chat. There's been quite a lot of lively discussion there. I was hoping some of the questions would fall neatly into little groups, and so I could group them and ask a specific question around that. But I think there are questions on many things. There are also a number of sort of clarifications, requests for other information. Yeah, for example, the guide. So the team sort of behind the scenes will deal with all of those, and we'll get out as much as we can following this session. So I'll go through and I will try and pick a few of the questions which I think are sort of generally applicable. So the first one I wanted to ask, really, it's one that came up quite early on. And I think it would be really useful to get a really short response from each of the presenters, and obviously Amy as well. But the question is around, it says, if health is a concern nationally and planning can help, which I sort of think we all think it can something be done nationally that is a requirement for development to address, rather than coming up with something locally in local plans? So it's that national versus local question, really. Should we be setting standards nationally or locally? Is it okay, Amy, if I asked for your thoughts on that first?
Yeah, that's fine. I started writing something in the chat and then thought it was too complicated, so I hope you do that. I mean, I think my sort of personal view is that there are things that are consistent health issues across the whole of the country, and that urban design and the National Design Guide are saying very much what Michael's talking about, that we can have an impact. So obesity is a problem pretty much everywhere. Michael, just, this is me with my being really simplistic. Obesity is a problem pretty much everywhere. Active travel, access to national green space and play are things that planners can make a difference about, and public health people can make a difference about. So that's already in national policy, but what the local plan is doing is saying, this is a particular issue here, or spatially, this is how we can affect a change. So I think that's the difference. There are things that we know are consistent, but you will have local data that can turn the dial up, that can say, we've got more elderly people here with this particular issue, and that is why we really need this, and it gives you more weight. That's my thinking, but Michael will talk about that a bit more. The tool that Michael mentioned that we use in Homes England, because it does that a bit of that simple translation between lots of the data to what does that mean about how do I actually plan a place, and what does that mean for my counsellors to understand that it is building for a healthy life. Because that the reason that change from being building for life 12 to being building for a healthy life was that it was written in collaboration with the NHS in order to get the learning from those documents into a sort of a planning and design document that was about the delivery of things. And so the first 4 questions are about the thing think about when you're looking at allocating sites, really. And then the next are a kind of master plan, the next 4 about site layout. And then the last 4 are the things you need to think about at the detailed level at reserved matters. So that's really useful because it goes with the timeline that we use at Homes England, and obviously lots of local authorities are using in terms of receiving planning applications. So Michael's put the link in. It's easy to find on the web. There's loads of places, but I think that combination of those that's certainly how, when I was in a local authority, that's how I was using the local intelligence that you're getting about your population.
Brilliant, thank you, Amy. Do you want to come in, Michael, just for a couple of quick comments?
Yeah, I think you can clearly see from the chat that there are different perspectives on just this particular issue, which, in a sense, is non-controversial, health and design. So in a way that kind of answers the question is, I think it's useful to have a clearer national commitment, if you like, to health and planning, health and design. But I think, to prescribe anything, we're going to you'll get a lot of backlash to prescribing anything great, unless it's clearly evidenced by kind of by research and kind of quite robust evidence. So in a way, I would say there's definitely things we can do in the National Planning Policy Framework and Planning Practice Guidance to strengthen how health is perceived and articulated in design, health inequalities, which doesn't appear anywhere currently. There's definitely something about strengthening the way that public health professionals can be involved in the planning process, from design, development, whatever it may be. Beyond that, I don't know whether it's appropriate to start prescribing things. I think it may be useful to say we prescribe 40% of all development should be green spaces. We can say that, but whether that's backed up by evidence and whether that's contextually appropriate, that's a different question. So I do agree from the chat that the things that we can say around the NPPF, and the things we need to appreciate around resourcing and those issues as well. And that's why I think the approach that I take is actually by enabling councils and others involved in the process, landscape architects, highway engineers, whoever they may be, enable them to take the right approach. That's probably the best way for now, than prescribing a certain way. I think depending on the kind of political situation, but for now, that's probably the best that we can do. It's not to say that it's the best that we should be doing, but it's the best that we can do at this point in time. Thank you.
Brilliant. Thank you, Michael. And I'll throw that one to Natasha as well. So national or local, what's the best way to lead?
I think starting with local, because then it does really address the specific kind of requirements of places. But I do think it would be the right thing to do to move towards having some sort of national kind of impetus around health, and having that more emphasised in the guidance. So all the requirements, sorry, not guidance. So yeah, I think perhaps it's a longer term journey, but having a consensus kind of model or approach that draws together lots of different work that's happening would be where I'm at. Yeah.
Brilliant, thank you. And then the next one I wanted to move on to, there's a few questions that appeared around designing for people with disabilities. And obviously, if we're designing for people with disabilities, which could be any of us at any time, we're also designing places which are also more accessible. If you're designing to allow for a wheelchair, you're also designing to allow for a pushchair, for example. So the question was put to you, Michael, but I think it's probably one for everybody, really. So the question is Michael aware of any outcomes of the recent accessible housing consultation? it would be a very practical health intervention to make the accessible Part M Level 2 a baseline for all future housing development. So I'm sort of thinking here around, I sort of remember the lifetime home standard as well, which I think again is sort of in this space of building homes that can be adapted for future need for people. That would be my understanding, but again, good perhaps if you want to quickly give your take on that, Michael.
Yeah, I think, or just to say, we have a housing and health program. So Josie here leads the team. So if you want to go into great detail around housing, please do get in touch. But I think, I think right. I think the general point is that designing for different population groups, doesn't necessarily, in my view, like I said, in terms of addressing health inequalities, may not be just about designing for particular population groups, because they exacerbate health inequalities. Like I said earlier, there's actually dementia-friendly environment design guidelines. There's autism planning design guidelines from America, and then for all these other concepts, there's very much focus on a particular group of society. The thing is, how do they link all together? I think someone mentioned in one of the kind of images that potentially may be kind of adverse to people with dementia or other kind of disability needs. So I think it's been very mindful about who you're designing for. There may be in some situations, some sites that you've designed particularly for a population groups, like if you're designing for dementia friendly environment or care home, then that's why you focus on. But in general, we focus on the general kind of residential neighborhood. Then you need to be mindful of everyone that you've designed for. I think in terms of the accessibility standards, I'm not aware that we've done any work on that, because there's deluxe area responsibility, but we do engage with them quite a lot on those housing issues. So I can pick that point up separately if needed. Thank you.
Okay, thanks. Amy, do you want to have a go on that one next?
Yeah, I mean, I think there's quite a lot of discussion about kind of inclusive design in buildings, but also in the wider public realm as well in the chat, which is great to see. And I think a lot of people kind of, I mean, to me, this is what design is about. It's about all the different spatial scales. So we're talking about how do you actually make a connected network and put your new sites in the right place, that they are actually walkable, down to, is the curb in the right place so that I can get my I can go in my mobility scooter to pick up my children from school. That is what we should be doing. That is design. That is, it's at every scale, and that's why it's fantastic. That's why everyone is an urban designer. All this discussion about who's if you didn't realise it, urban design is a bit like being a Buddhist. You're all in the tent, even if you haven't realised it, because everyone's involved. And you can't just be an urban designer. You're always an urban designer and something else, because that's the point. So yeah, I think we're all in it together, and we all need to be. I mean, this is great. It's because people just need to think about other people using the spaces. And if the trick I always use is thinking about it particularly from a child's perspective, because that is actually something that most people can relate to and have more of a direct memory of. But can I walk to school on my own if I'm 8? Am I allowed to go to the shop on my own if I'm 8? How will I use these spaces after dark? And just try and imagine yourselves in the plans, because I know this all sounds a bit kind of motherhood and apple pie, but actually it does change the way people think about it. And I think certainly when you're talking to other people in the planning system and public health people, it's really helpful to try and to imagine a future person in that place, in that plan. So trying to take that 2D to 3D.
That's brilliant. Thank you, Amy. That's a really practical approach, because I think a lot of it is thinking around the way that we use spaces, our families use spaces at different stages in our lives. And it's very difficult to forget, when you had toddlers, you use spaces differently, and it's thinking about those things. Natasha, I didn't want to leave you out. Would you like to make any comments on designing for obviously people with disabilities and a whole range of different needs?
I think Michael and Amy have sort of covered it. I think, yeah, it's about understanding it from different perspectives, and I suppose having it's the degree of empathy in the way that you're looking at space. So yeah, I think that's been covered.
Brilliant. Okay, thank you very much. Then to move on to a slightly different topic area, the question is around sort of design. The question is basically, isn't one of the problems the lack of urban design expertise within local planning authorities? So that's basically the question, but the way I wanted to perhaps turn that round a little bit, just for the panel, is how do we help local planning authorities in terms of boosting their design capacity? What are the tools and techniques that we can provide? What do we think is out there available to boost that capacity that exists? Does that make sense? Probably completely angled that. So the base question was, isn't one of the problems a lack of urban design expertise within local planning authorities? So my question is, how do we help with that?
Natasha,
so
I was just going to say, Natasha, I put a bit in the chat about public practice, but it might be helpful to explain what that is, because I kind of put a link in, but that I would maybe you do that bit.
Yeah, that's fantastic. We'll throw that one to you first, then, Natasha.
Yeah, so I've mentioned public practice, but I didn't explain what it is. It's a program to bring built environment professionals working from private sector generally into working within local authorities. So it's to build up capacity and bring skills to councils. So that's one of the reasons why I've been within Brent Council as a placement for a year, and people tend to stay on for longer and progress their career within the public sector. I think 90% of people carry on. So that's a really great, one really great way that's already happening. And I highly recommend it for local authorities.
Brilliant. Okay. So, Amy, do you want to come in now on that capacity question?
So it's something that, we know there's a huge issue of capacity in planning in general, but also specifically design within local authorities. And that's part of the public practice model, is to help with that. And Homes England has been assisting public practice to sort of move out of its core base out of the southeast. And the other things that I think are really useful, obviously we're doing things like this, like the training programs, but that's only giving you so much. But there is the Design Network, which is a national umbrella body for your local regional design review panel. And I would say use that resource. You can build that into your local plans, that other people need to use it, but use that resource, because that is some access to local regional expertise to support you. And actually, just looking back, I can see Andrea's in the chat, who I worked with years ago on doing the North Northants Joint Strategic Plan. We actually used the local design review panel to do kind of walk and talk overs with us to all of our strategic sites in the local plan as they were emerging, to kind of go, what are the key design things? So you've got there the proper multidisciplinary group that you need, landscape, ecology, engineering, all of those people that you can then access. And it's I thought it was really cost-effective way of getting a lot of extra support in. So that's make friends with your local design review panel, I would say.
Brilliant. Okay, Michael, would you like to say something about how we boost capacity for local authorities in terms of design?
Our target audience is the local authority public health teams, and similar to planners, they would need some kind of upskilling around urban design, be able to read maps and think spatially as well. So it's not just a planning issue. It's across anyone involved in the planning and design of a place. I'll make the wider point about education, or tertiary education in universities. I think many of us will go through planning degrees. We do have some kind of urban design course and modules. But I think around health and design, health and planning, I think it really needs to be tackled by universities, to be upstream in the process. But by doing CPD like this, sometimes you don't get into great detail and you don't apply the knowledge. You don't get the chance to apply the knowledge. In America, they you can do a joint degree, master's degree in planning, design, and public health. You already come out of a 3-4 year degree as a planning for health specialist. So we're already years behind the Americans in this particular way. And, but actually a lot of the expertise do reside in the private sector. I think the challenging thing is, definitely for the planning for health agenda, when you appoint someone to this agenda, you are potentially taking that expertise away from the traditional planning role. And so I think the question comes back to, so how do you educate people in the university so they when they come out of it in this particular agenda, rather than you coming out of it as a planner and then you take them away from a local authority planning team into the public health sector. That means there's one planner short in that kind of way, and there are recruitment issues around this agenda in public health as well. So it's a bigger system issue rather than just the local planning authorities, and we're trying to tackle it firstly through the workshops that I mentioned, but hopefully separately as well by engaging universities in the longer term, but nothing in the short term, I'm afraid.
Brilliant, thank you, Michael. And then just really quickly, one other question I just wanted to ask. It's around, we've had several mention of design codes, and we've also got some comments and questions on how we deal with house builders and developers and ensure they deliver what we want. So could we literally get just, I think I'll probably come to you, Amy, first. Just literally a minute or so on design codes and how you think those could be used to help deliver.
Yeah, there's quite a lot of discussion about kind of people wanting rules, and you can't write a rule for everything because your document would be thousands of pages long and no one would ever read it. But the idea of a design code is to be quite is to set out rules, and they are in plan and in text as well, but they need to be directive. It's a set of directions. It's not guidance for it to be a proper code. So you need to decide what you want to control if you want to do that, because you're not going to be able to control everything in a rule. But you could choose that there are specific things that you want to code, and then you can control them through that mechanism. But obviously the code is hanging off other local plan guidance and national guidance. But that's my summary in the chat. Is you can't have a set guidance on everything everywhere. That's an impossible thing for somebody to write, and nobody would ever read it. It's just too big and difficult.
Okay, that's fantastic. Thank you, Amy. I think we are just about out of time. I won't come to Natasha and Michael, to you on that one, if that's okay, because I think we just are pretty much at time now. So could we just have the next slide up quickly? Because I've got a couple of things, obviously, I need to do now. I need to say sort of, thank you very much to Michael and Natasha for, all their work in putting this presentation together. That's been fascinating. Thank you so much, and I hope everyone's found that really interesting. So we've got a number of sort of take-home messages we sort of wanted to leave you with, and I think that brings us about to time. So thank you all very much for joining today, and I hope you've enjoyed it and found it useful. I certainly have. It's an area I didn't know much about, but I've learned a lot. So thank you all very, very much indeed. Okay.